curious what you all are thinking about models that might evolve in the next phase and what changes, if any, or what innovations leaders ought to be prioritizing as you think about delivery models in the next phase. And Dan, this one comes to you first.
I don't see the tenor of the movements that we've seen in the past few years changing very much. I think the attention and innovation on low-income populations and questions of addressing equity, which I think got a lot of energy in the past administration, might lose a little of its steam going forward. But otherwise, I don't see too many changes.
And we're seeing more of these advanced models take place also in specialty care. You're starting to see more in oncology and cardiology, and I think you'll start to see more of those. And again, it's where we're seeing investment opportunities there to have actually, again, a focus on sustainability and quality and more consistent outcomes over time and leveraging data in a really unique way. And I'd be remiss without talking about AI. I think that is a place and an opportunity for us to actually drive some efficiencies within the system, both from a back office perspective, but then also really thinking about talking about providers and allowing them to operate at the top of the license. So if you start to look at these AI scribes and some of the other innovations that have taken place that are just really helping people spend more time on the delivery of care versus on the administration of care and on the technicalities of payment, which I think is where we have a tremendous amount of opportunity. We're already seeing some of that come into the infrastructure. I think we'll see more of this administration for sure.
I agree. I think about, changes in the models, delivery models, et cetera. It's just a continuation of what we've been going on through for a long time and continue doing, which is the fundamental shift in how our healthcare system works, to move from a system in which consumers didn't pay for their healthcare and the providers of healthcare got paid for doing more healthcare. So we had a complete lack of alignment historically, just as an accident of history, of how our system was created, which we've been working at for 30 or 40 years of trying to move away from in one way or another. We laugh about the term value-based care because we've been doing delegated risk models or sharing of risk for 35 years. Now it's called value-based care, but it really is just an example of the continuing evolution of really creating economic models that tie outcomes into what's done to create those outcomes and have aligned participants in the system. And I think that will continue in a pretty significant way, given who the people that will be coming into the administration who are big believers in those type of shifts.